Good afternoon, everyone. Welcome to our webinar on the Toronto Downtown East Justice Centre. My name is Trevor Timchuk, and I'm the chair of the Communications and Knowledge Exchange Committee for the Provincial Human Services and Justice Coordinating Committee. Today's webinar is being recorded, and the recording and PowerPoint presentation will be sent out following the webinar. We will have a question and answer period at the end of the webinar. To ask a question at any time, you can put it in to the chat box or the Q&A box at the bottom of the screen, and we'll try to get to as many of them as possible at the end of the webinar. There will also be a brief evaluation survey, just a couple questions that will be sent out following the webinar. And about the HSJCC network, we're comprised of 38 local committees, 14 regional committees, and 1 provincial committee. Each HSJCC is a voluntary collaboration between health and social service organizations, community mental health and addiction organizations, and partners from the justice sector, including Crown attorneys, judges, police services, and correctional service providers. And before we begin, I'll hand it over to Scott McKean for a land acknowledgement.
Good afternoon, everyone. My name is Scott McKean. I'm from the City of Toronto. I work in the city leading SAFETO, which is the Community Safety and Wellbeing Plan for the city. And I also work embedded in the Ministry of Attorney General on advancing justice centers. And so before we begin, I would just like to acknowledge that the land that we're on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis people. I also acknowledge that the City of Toronto, or formerly known as Takaranto, is covered by Treaty 13, which was signed by the Mississaugas of the Credit, and the Williams Treaty that was signed by multiple Mississaugas and Chippewa bands. I also just want to take a second to acknowledge that not all people came to these lands as migrants and settlers, particularly those who came here through the transatlantic slave trade. And in my ongoing personal efforts and the City of Toronto's efforts to confront anti-Black racism, just wanted to take a second to pay tribute to those ancestors of African origin and descent. Thank you so much, and I'll pass it over to Holly Lubert.
Good morning. Our Executive Director, Dana Aaron, is currently at a community engagement with Indigenous leadership and elders in Kenora today in anticipation of the launch of our next site. So she's unable to be here this morning with us, but on her behalf, I'd like to welcome you to the MAG Justice Centre presentation on the Downtown East Justice Centre pilot. As with all of our initiatives, the Downtown East pilot is about trying to deliver justice services differently, trying to do justice differently. It's about innovating, it's about working across sectors, and it's about working differently with community. So we've been really excited about the new work we've been doing with community in the Downtown East to try to improve outcomes for justice-involved populations. And we're really looking forward to sharing a little bit about what we've been doing at our site with you today. We have an all-star lineup for you, and I know we're a bit tight on time, so I am going to, without further ado, pass things over to Kate Matthews, who is the Crown lead on the Downtown East Justice Centre.
Thank you, Holly. We could have the next slide. Okay, I understand a number of you have probably already attended some of the other presentations on justice centers, so I won't spend too much time on these first 2 slides, but just to give some context about the Downtown East Justice Centre, we are one of 4 sites of justice centers that are being developed in Ontario, the others being in the Toronto Northwest, in London, and in Kenora. 3 of those 4 have been up and running for over a year now, and Kenora hopefully will be launching very shortly. Next slide, Holly. So we're beginning in all of these sites with pilot models, so that we can then assess the pilots and see how we can expand on the current models. We developed these justice centers through a participatory design process. so that we made sure that we were getting the full input of all justice and community partners so that we could try and develop the best model possible. With the onset of COVID, of course, we had to adjust all of our models. And some of the adjustments made here are the ability to do both virtual and remote court proceedings. We're trying to reduce the number of individuals held on remand and improve access to community-based supports through virtual services as well as in-person services. So the Downtown East is based in, as it says, the Toronto Downtown East. What that means for us is we're in the, really talking about what we call the Moss Park neighborhood in Toronto, which runs between approximately Yonge Street over to the Don Valley and from the lake up to Bloor, for those of you familiar with Toronto. It is a neighborhood that has quite a high population of people who are living with housing insecurities, mental health challenges, substance abuse. They cycle through the courts very frequently, typically with low to moderate level offenses. Their high percentage of them are held for bail. You can see some of the stats there in the box on the right. A high number of those are property and what we call administration of justice related offenses, so breach of court orders, failing to appear in court. A lot of people who fit in this category don't qualify for some of our existing processes within the justice system. So they don't qualify for direct accountability. They don't necessarily qualify for mental health court anymore. Drug treatment court might not be the appropriate route. And in all of these cases, the need is complex and not necessarily best suited or best served by, for example, a mental health court on its own. So in order to try and address these issues, we launched our Justice Centre in May of 2021. We try and focus on these complex, high needs clients. And we do so by trying to co-locate justice with on-site specialized health services, including primary care, psychiatry, addictions medicine, developmental disability supports, and case management services. Next, Holly. So some of the key features of the Downtown East are that we try and identify eligible candidates or participants really right at the very time of arrest, because we want to be able to offer services and engage them right at the time of arrest, because we know typically once people are released, we have a hard time finding them again. So people are identified right at the time of arrest. We have a first appearance in the Justice Centre, typically within the week, 2 weeks at the outside. We have arranged with 51 Division to have direct releases in appropriate cases so that we can reduce the number of people who are held for bail in the first place, if it's in fact appropriate to do so. We can still get them connected with services right away at the time of their arrest, even if they're going to be ultimately released directly to the Justice Centre. Our key agencies that we're working with here, you can see, are the City of Toronto, Soundtime Support Services, Inner City Health Associates, Surrey Place, and John Howard Society through the City of Toronto. So we're, by partnering with those particular community agencies, we're working with professionals who really understand this population, understand their needs, work with them really intimately, and have that history and experience. We're able to offer on-site access to supported video suites to facilitate remote court appearances, and that is at Soundtimes. We are able to offer as well on-site at Soundtimes access to these health and case management services through Inner City Health Associates. John Howard Society participates as well. They attend our courts every week, and they can offer housing support as well with dedicated housing workers. Surrey Place Also, a very exciting addition to the justice system in this process, because they provide those supports, specialized supports to people with developmental disabilities. In my experience, prior to the start of this Justice Centre, often people with developmental disabilities were being inappropriately kind of categorized as having mental health issues, and those were the only services being offered. So it's really important to have the work of Surrey Place as well. Holly? This slide is very dense and complex, so I'm not going to take you through each and every word, but what I'll just say briefly is that this shows the pathway of somebody who decides to come into the Justice Centre, which is a voluntary process. Nobody is forced to come to the Justice Centre. We're giving the opportunity for them to do so. There's my timer already going off, so I'm going to be really quick. Basically, there are 3 points of entry. As I said, we try and get them at the time of arrest, either in bail court or through a direct release from the station. But we will also take referrals for cases that are already in the justice system in the normal course, where people identify them as being appropriate for the Justice Centre. We get them connected to case managers as soon as possible at the time of arrest. We work collaboratively with the bail vetters at College Park, and we have an embedded crown as well at 51 Division, so that everything can work as smoothly as possible, and we can reduce any unnecessary adjournments and remands in bail. Once somebody has agreed to come and they're released from custody, they're to go to Sound Times or meet with Surrey Place as appropriate. Assessments are done to see what their immediate needs are and also identify their long-term needs. Then an individual plan is created. That plan is a collaborative process. It is meant to be driven by the participants who know best what they are able and willing and ready to work on, but also reviewed by counsel, Crown, the justice who's sitting in the court, and that is monitored throughout the process. The idea is that while we're offering these supports and the services, we can also give them the opportunity to work to a mitigated result, so that we can offer them the same range of outcomes as in a normal process, anything from a withdrawal, diversion, peace bond, and plea and sentencing. But the goal is really to try and make sure that we can help to stabilize the participants, reduce the victimization in the community, and also reduce unnecessary incarceration. And I think that is the best way to explain that quickly. Thanks, Holly. Justice Hogan.
Thank you, Holly. Yeah, I think Kate has really gone through most of the sort of legal procedures in the Justice Centre. So I'm just going to talk about it a bit more broadly, and why I think that a Justice Centre was important and necessary. I won't say when I started sitting, but it was a very long time ago. And I certainly didn't have hair the color that I have now, but it's well over 30 years ago. And I've always been at Old City Hall. And when I started sitting, Toronto was a very different place. Our court was a very different place. And the people who came in front of us were, in a lot of ways, very different. And we didn't have the volume. We did not have the extent of the social problems that we have now, at least in my view. We now, of course, in Toronto are in the midst of a terrible housing crisis, not just affordable housing, but the necessity for supportive housing as well. We continue to see the results, and it's so long ago, but I can remember when it was happening, which does certainly age me, but the deinstitutionalization of our mental health facilities And obviously something that I agree with should have happened, except they forgot the other part of it. They took people out of the institutions, but they failed to, when I say they, I'm talking about the government. It failed to provide the necessary resources in the community for them. And so what we saw was lack of housing and other supports. And I started out my career as a director in Parkdale Legal Services in another community in the 70s. And at least then, the people coming out of the institutions had the rooming houses to live in. The rooming houses were not great, let me tell you. They were pretty bad, but at least they provided roof over people's heads. And then with gentrification, which hasn't hit all of the areas of Toronto, but it has hit a lot of them. A lot of that housing disappeared as well. And we now see, if you read about it in the paper, it's often said that jail is the new housing for the mentally ill. And that to a very large extent is true. I decided after one of individuals came in front of me at the Justice Centre that the TTC now seems to be the new housing for individuals who have issues and come to the Justice Centre, because there are no beds available, and some of them have ended up riding the all-night buses. And the substance abuse issues certainly weren't then what they are now, and it's very, very complex. And as all of you, I'm sure, know, the number of overdose deaths in this city and in this province, in this country, are awful. It's a tragic, tragic situation. I was for many years the lead judge in the drug treatment court and continue to do backup there, and have sat on a City of Toronto drug strategy panel. And it's so tragic. And as I said, we've lost so many people. So what over the years I have found is that what's coming in front of me as a judge are all of the social ills, if I can put it that way, the lack of the social determinants of health that impact so many people living in the inner city and obviously other parts of the city as well. But I've been dealing at Old City Hall and the same in College Park with the inner city issues. And as a judge and as a criminal justice system, we can't cope with that. We don't have the resources, we don't have the knowledge, we don't have the expertise. But the answer, I'm afraid, to many issues these days is we'll send it to the court. The court will deal with it. Well, the court can't deal with it. We have a terrible backlog as it is, and as I said, we don't have the training or the resources to do that. That's why a number of specialty courts grew up in our court: the drug treatment court, the mental health court, the Indigenous persons court, known as well as the Gladue court, to try and assist some individuals who are caught up in the criminal justice system. But they have limits, and they have eligibility criteria, and a lot of people fall through the cracks. And that's something that I saw many years ago, as Kate and Holly and others know. I've been pushing for something like this for many, many years, having had the opportunity to see it in action in the United States. And while I don't hold the US up as an example these days of much, but there are a lot of good things and good ideas that have originated there. Sometimes they're not very good in terms of what happens once the idea has been generated and implementation. But they've certainly in New York City with their Red Hook Community Center and some others, Community Justice Center, done some really good work. And so what we can do now in the Justice Center is not treat it really as treat those who come in front of us as being participants only in a criminal justice system, but looking at as I say, primarily the social determinants of health, and recognizing that most of the problems that are coming to us are social problems, particularly issues that should be dealt with as health issues: problematic substance abuse, for sure, mental health, poverty, all of those things that are the root of getting people into the criminal justice system, which is not where they should be. And I know my time's up stuff too, but I'm one of the things I say to people when they come in is, we're different. We're not a regular court. We're a friendlier place. And just as an aside, hopefully when we get our space, we can design our courtroom so it is a trauma-informed courtroom. So it isn't a place that re-traumatizes the people who are coming in, because that just makes things worse. And the people who come to us, as Kate has said, have been through the system. They've been through the revolving door. They don't have a very good view of courts. It's not a place they want to be. It's not a place that's helped them. So I try and talk to them in a softer way and say, hey, we're not all about punishment and enforcement here. We're just trying to help you, to support you, to connect you. If something happens, for example, if you're using and you go off on a run, don't stay connected. Don't be afraid to get in touch with your caseworker. We're concerned about you as people. My first response isn't going to be, if you don't appear to, and I probably shouldn't say this, but I do, is to issue a bench warrant. My first response is to say, let's try and find this person. So we deal with them very, very differently. And hopefully by having some wraparound services with us when we actually do get a physical space, because it's been challenging trying to do virtual court, particularly with this population who aren't savvy with technology, don't have the technological resources, and have been going into Sound Times and other community agencies to Zoom into court. But it's not the best way to do things. And when you can't actually physically see and engage with somebody in person, it makes it even harder. And what I've learned in the other specialty courts, where I also said, as I say, it's so important to establish a bond and a trust, because these people have been let down by the system so many times. And why should they trust us in the justice system? Why should they trust me as the judge? And that bond has to develop and has to be established. And for people, it can take a long time, and you need the one-on-one, the in-person connection, and hopefully that will happen. And also with Inner City Health right there, and hopefully and Sound Times and some of the other agencies who will be with us physically or very close, they won't have to travel. They can just go from our court through another door, and the supports will be there. I remember being at Red Hook and watching the judge say to somebody, well, you didn't do such and such, you breached your probation, but my sanction is going to be some community service. You can go through that door there, and there's somebody who's going to help you, and you have 4 hours and you can do it right now, which is, of course, what makes a big impact on somebody having it available right then, as opposed to months down the road. Or, for those people who are interested in pursuing education, there are classes upstairs, GED classes, or whatever they call it in the US, and you could go upstairs and get registered and do that. The same with resources for people with children and families and whatever. So it's really a recognition, and it's been a long time in coming, but we need it, that the traditional court system doesn't work for this particular, doesn't work for a lot of people, but particularly for this very complex population. And at that, I'll stop.
Thank you very much for speaking with us today, Justice Hogan. It means a lot. Our next speaker is Lana Fredo, who is the Executive Director from our partner, Sound Times.
Hi. So Sound Times is currently hosting the Community Justice Center, and let me clarify that it's as an interim measure, because as the Justice Center planning was getting underway, the pandemic hit. So we're sort of a go-between until the actual Justice Center comes to fruition. So Sound Times has been in existence for 30 years come August. And we are what was once known as a consumer survivor initiative, in that everyone who is involved with Sound Times has lived experience with mental health, addiction services, or the criminal justice system. Prior to the Justice Center, Our services included access to our resource center, and we have funding and dedicated staff to do mental health and justice prevention, mental health and justice diversion and court support. We have release from custody planners. We were providing addiction and harm reduction services, and we had the psychiatry and primary care services provided by Inner City Health Associates. Dr. Andrew Bond is going to speak more about those services after I do. And as well, Sound Times has an embedded legal clinic that is funded by Legal Aid Ontario, where participants have access to a lawyer who has a broader scope of practice than your traditional legal clinic would have. So all of those services are accessible as well to any users of the Community Justice Centre, any of those participants. And as well, while those participants may be discharged from the CJC, they can, if they want, continue to use Sound Times and receive support within any of these programs that they choose to do so. Can I have the next slide, please? So at the moment, our role in the Community Justice Centre is to provide a location for the virtual court access. Court for the CJC happens on Thursday, and basically the justice system takes over Sound Times on Thursdays. However, it's important to know that our own research indicates that most of the users of Sound Times, if they have one legal matter before the courts, criminal justice matter, they usually have other legal matters, either at quasi-judicial hearings that are required, or in the area of administrative law. So that access is important to them for not just their court dates, but for other virtual services that they may require. There are also dedicated case managers assigned to this project. And very importantly, we've been chugging along for about a year now, and we've been able to, I should backtrack a bit and say that Sound Times has been open throughout the pandemic. So we've been doing face-to-face service, but as of late, we've been able to loosen things up a bit. Also, it's summertime, and I've been able to rejig the interior of the building and increase the air filtration. So we've been doing, as of the beginning of the fiscal year, quite a bit of structured group work, and preliminary data indicates that some of the biggest users of the structured groups are in fact the CJC clients, although they represent a small portion of our overall service users. They are big users of group work. So we do every day provide addiction support, and the tool, the model that we're using is Smart Recovery. And in the afternoons, each day of the week, there are groups running that are of relevance and that have come from the users of the service. So like one day there's a housing help group, another day there's a group that discusses basically how not to catch another charge. There are so those groups are focused around the interests and the desires of the participants, and then there are some socially focused groups as well. I mentioned that post-discharge, Sound Times is committed to continuing to support these clients, because the model of the Justice Centre is that those individuals will be engaged for, I think, a maximum of 6 months. However, the individuals that we're working with have very long-standing needs, and those of us that work in the social service side of things know that these days things very rarely get sorted out within 6 months. So we're committed to maintaining service for those clients. I will say it's also important to note that for the last fiscal year, there were 251 clients referred to Sound Times from the Community Justice Center, through the Community Justice Center. But of those 251 clients referred, 108 of those were existing clients of ours who we already had longstanding and ongoing relationships with. If I'll say anything about the Justice Center, someone's moving their mouse over my photos. Yes, there are photos there.
Sorry.
The top are the gardens where we hold most of the groups, weather permitting, and those are the virtual, people have their own private virtual terminals and have support to use them in the main building of Sound Times. But I will, anyway, back to what I was saying was that it is the long-standing and engaging relationship, I think that leans a client more towards success than any specific referral. And so in keeping with that thinking, there is no sort of scheduled structure outside of the court that clients are held to. They are perfectly free to come and go at Sound Times anytime that they need something, and when they come through the door, they will always be able to get help with whatever it is they're asking for. And with that, I will turn it over to Dr. Bond to talk a little bit about each.
Thanks so much, Lada, and hi everybody. Apologies for my delay on my end. So great to see everybody and glad to be here to chat with you about this important work at the Justice Centre. I'm going to start with just 2 slides. First, focusing on the context of this work and how the connections between homelessness, health, and justice and the justice system, and then more on the second, we'll focus on process and how it actually works with the JC and the health side of services. So first, just sort of some situating context. I think it's always important, even though everybody here probably is deeply aware of this, just to take a moment and remind, I think, building on what Lana said and also Justice Hogan, of remaining mindful of the deep social and physical trauma of homelessness and just how truly traumatizing and disconnecting and disorienting and difficult the experience can be beyond those of us who may not have had lived experience can even imagine. And in connection with that, also always important to foreground the important experience and the unbelievable experience of Indigenous folks of colonization and displacement, and the Indigenous definition of homelessness as well. Mindful of that, I think it's important to always just, again, also situate in the context of an acknowledgement that we're on Treaty 13 lands, and that these are the traditional territories of the Haudenosaunee, Wendat, Mississaugas of the Credit and Anishinaabe nations, and to continue to be an important gathering space for Indigenous peoples. And I didn't, apologies if there wasn't a land acknowledgement in the beginning, but wanting to make sure that we take a moment to just situate this. And part of the reason for doing that isn't just to pro forma say these things or think about these things, but to they're intrinsically connected to how homelessness, health, and justice are connected, and how we can work with those connections to actually see a different approach and path to health and better community justice. So one important piece is to know that in the context of homelessness, as a health driver, we know that the, sorry, folks, we just had a call coming in, I apologies. We know that the impact of homelessness on health is absolutely profound, that the life expectancy of most folks who are homeless on average is up to 47 to 48 years. That's over 25 to 28 years less than gender matched folks who are not homeless. It is the most potent social driver or social determinant of health, often considered to be something as a compound determinant. Multiple exclusion homelessness is another concept that's used, or for Another one is around disadvantages that clustered, because oftentimes homelessness is deeply, as most folks will know, connected to income challenges and poverty, other forms of physical violence, separation, experience of discrimination in the context of LGBTQS youth, and those as adults, newcomers, and refugees as well. So huge amounts of displacement and violence experienced. And that leads to both behavioral related health conditions, lack of resources, and the health conditions there from both the housing itself and resource limitations on health. And what we find is that in practice, many folks who are chronically homeless, and being really important and mindful that homelessness is not a unified experience and that there are different segments of homelessness ranging from those who are chronically homeless to those who are much more episodically and short-term homeless, that it's more around emergency homelessness. Those who are chronically homeless have higher rates of both combined concurrent complex medical conditions, mental health conditions, substance use disorders with possibly acquired brain injuries that we know in chronic homelessness range up to 30 to 50% of folks have some version of acquired brain injury and developmental disabilities as well, including neurodiverse individuals. And so we know that we are dealing with people who have a huge amount of complexity. The system, the health system in particular, is poor at handling folks who are not complex. It is that much more difficult, and people are that much more poorly treated living with these conditions as a result of ultimately their homelessness. The other is that health conditions that arise from homelessness drive further homelessness as well. We know that if you look at the street needs assessment in Toronto, for example, if you collate all the different health inflected conditions that are listed by folks who responded as a cause of homelessness, that is one of the leading causes, if not the leading cause of self-identified homelessness in Toronto, for example. And so it's a really critical, important area for destabilizing and working on their health and social needs to ensure that we can both improve their health, but also improve their justice outcomes. So much so that I think it's worth just underlying that this combination, and I'll just run through this list of, for folks who are chronically homeless, resource restriction, disconnection from supports, negative social capital, which means social capital that may lead to a culture of violence or experience of violence in the social community, cognitive impairments, injuries and disabilities, substance use victimization, and very poor treatment from health and social services for the most part, sets people up to fail. And so, so much so that one of the leading jurists and legal theorists in the world, Jeremy Waldron, actually used the experience of homelessness as the exact definition and way to explore the social conditions of individual freedom. And the reason why this is important from a legal context is that when you have a high-risk context, high-risk situations with limited skills and very limited resources, we are setting people up for criminalized contexts and behaviors and practices. And that is the point of intersection and how we can try to intervene so that we do not criminalize these processes as much as possible. And that is why we need to work together across health, social services, and justice sector. Really quickly, Intercity Health Associates is a specialized community clinical services program or organization with 120 physicians, over 40 nurses with 12 departments and 70 interconnected sites across the city of Toronto, serving folks who are homeless or formerly homeless. On our Justice Centre team, we have a primary care physician clinic, a psychiatrist, as well as a specialized substance use care team. And next slide, please. Sorry, guys. So in terms of process and how this works in the roles, what happens in the court is that the court will have an assessment, connect people to case managers, as mentioned earlier by Kate, and what will happen is the case manager will then connect with usually each primary care physician or the psychiatrist, depending on the immediate needs, for a rapid referral and intake. Usually within a week, and sometimes within just a matter of a couple of days, we can get somebody into clinic for a full clinical assessment and connection and coordination with case management. The roles of the different team members, the primary care team roles include doing a rapid comprehensive clinical assessment. And so this is an extremely thorough and fast assessment, often can take anywhere between an hour to 2 hours, depending on the circumstances, to go through and understand someone's entire history as much as possible, gather public histories and available information, liaise with the case management, gather information from the Justice Centre team to understand what has led to Justice Centre involvement, and have the fullest possible understanding of what might be the clinical needs, and especially from a client-centered perspective, what does the client identify as their most critical needs to try and help them manage health conditions that may be related to their involvement with the justice system, whether or not they are involved with an existing provider elsewhere or not. We really focus in on very complex case solving and problem solving. From there, and from the assessment plan, we come up with a care coordination and the master clinical care plan where we work with the case managers and have an overall approach that the primary care team really holds the pen on overseeing the full care plan that includes the medical issues that may be going on, psychiatry and mental health related issues and substance use care issues. And the psychiatrist will similarly do a comprehensive assessment in the context of mental health, specialized mental health care needs, mental health care coordination, come up with a treatment plan and work with the primary care provider to ensure that that treatment plan is implemented, but also is built into the overall care planning and care coordination and services and referrals if they do need to go off-site. The third arm of the clinical team is the substance use care, which includes an on-call dimension, a direct on-site service option, and a specialty hub that's housed at the Inner City Family Health Team in partnership with Inner City Health Associates. And we have a continuum of services available for substance use care, including harm reduction and safer supply, risk mitigation, prescribing, anti-craving medications, and opiate substitutions, depending on the needs of the client. And have everything from primary care to internal medicine to psychiatry, including trauma-related therapy for people who suffer from substance use conditions that are causing harm that they want to work on. So that is the clinical team. It's fairly large. The substance use care team is about 12 folks. It includes the directors of some of the largest substance use care programs across the city of Toronto, including CAMH, Women's College, St. Mike's, and UHN. And together we work to come up with a really coordinated and rapid care plan for folks, and we connect back with the case managers and ensure that they have a clear understanding of our care plan on the clinical side and have the resources to be able to then communicate back to the Justice Centre so they know that the client is engaged with this comprehensive care to try and support the underlying health-related and social-related needs that are affecting their Justice Centre involvement to then inform the practice of the Justice Centre and the judicial process. I'll turn on the next slide. And thank you so much, everyone.
Our next speaker, you got it.
Sorry, Holly. Thank you. Hi, everybody. I'm Melissa. I'm the Developmental Justice Case Manager at the Downtown East Justice Centre, and I work at Surrey Place. So Surrey Place is a large nonprofit organization in Toronto. We have 11 sites across Toronto and Peel, and we provide specialized services for individuals who can be either children, youth, adults, across their entire lives with autism spectrum disorder and any adults with developmental disabilities. So some of our comprehensive programs and services range from assessment to diagnosis, one-on-one treatment, family counseling, group support, and it's provided by a broad network of clinicians and professionals. So just to quickly note, some of the programs available at Surrey Place could include audiology, counseling, behavior and occupational therapy, wellness services, psychiatry, family medicine, and much more. Next slide, please, Holly. So what is the Developmental Services Ontario Toronto region? So Surrey Place houses the DSO Toronto region, and the DSO is the single point of access for all adults with a developmental disability who wish to access MCCSS funded adult developmental services and supports in Toronto. To be considered eligible, individuals must be 18 years or older, living in Ontario, and have a confirmed diagnosis. So DSO is based across Ontario. Toronto services are limited to people who live in the Toronto area. However, if they happen to move outside of the city, they're still eligible. They just have to connect with the DSO in their new region. So it is important to note that DSO is for individuals 18 and over, but at the age of 16, they can start the eligibility process to see if they might qualify for DSO and start accessing services right when they turn 18. So just a quick way to note how to get connected. So if the individual is over 18, they can call the DSO and begin the intake process. And if they happen to be under 18, they can call Surrey Place's centralized children intake to begin the referral process. And just to note, some of the funded services through the DSO include some housing supports, community participation, case management, respite, specialized clinical supports, and the passport program. Next slide, please. So as I mentioned, I am the Developmental Justice Case Manager at the Justice Centre, and I work with individuals who either have or are believed to have a developmental disability and are over the age of 18. So the reason we say believed to have developmental disability is because sometimes people, sometimes people may not recognize that they have a developmental disability. They may not qualify for the DSO. So we believe, I'm able to work with dual diagnosis justice coordinator at Surrey Place, and we're able to prioritize a psychological assessment to see if the person might have a developmental disability and is eligible for the DSO. So instead of the typical 2-year wait that it might take for an assessment, it could be as quick as 3 to 6 months with the prioritization that we're able to provide. So Surrey Place was brought on as a partner with the Justice Centre, and this partnership is incredibly important. Many times, as Kate mentioned, we notice people with developmental disabilities are overlooked and frequently lumped in with those who have mental health challenges. And people can go their entire lives without recognizing they have a developmental disability and accessing the proper supports. I've actually recognized this throughout my last year with the Justice Centre. We've seen individuals come through with long records of petty crimes, and after doing some investigation and asking a few questions, we recognize that they may have a developmental disability, and we are able to submit a referral to the DSO. So since we've started, several of my clients have been deemed eligible and have started to receive DSO and Surrey Place reports. Support. So thankfully, the Justice Centre has partnered with Surrey Place and acknowledges developmental disabilities and ensures these people are connected to the appropriate supports to reduce recidivism. So just a tiny bit more about my role. As I mentioned, I'm a case manager, and my role is the same essentially as the Sound Times case managers, where I'm able to connect with individuals deemed eligible for the Justice Centre. And I work closely with them to create an individual plan and their own individualized goals. So throughout their time with the Justice Centre, I assist with integrating supports to address some of the factors which may have led to the individual's recurring contact with the justice system. And overall, my goal is to ensure each person feels connected and supported in the community and ultimately leads to reduced recidivism. Thank you.
Thank you, Melissa. Our next speaker is Mark Litton from John Howard Society, Toronto.
Thank you. Good afternoon, everybody. So my name is Mark Linton, and I'm the Director of Reintegration and Outreach Services with the John Howard Society. And I think we're the newest partner. There's been, it seems like there's been partnerships going on for a while, and we've been around for about 2 months. So it was very interesting for me to sit back and sort of take in a lot of the earlier speakers. And while I'm familiar with the partner agencies, but just to hear the in-depth reality of their involvement with the Justice Centre was really good for me. So I appreciate everybody that has spoken earlier before I had an opportunity to speak. So John Howard Society is really focused, our focus is geared to effective, just, and humane responses to crime and its causes. And by promoting the fair and humane treatment to all incarcerated persons, seeks to ensure that all forms of detention, imprisonment comply with relevant legal and human rights standards. And so in a nutshell, when I present to new hires and other partner agencies, it's really, John Howard's really about second chances. And in this environment, sometimes it requires a third, fourth, and fifth chance, considering some of the nuances that we have with some of the challenges that we have with the clients that we engage with. My programs, like John Howard in itself, we have a lot of programs that are not really on the table for discussion, but just a point of reference. There's our halfway houses that we also support. We've got court services that are currently involved with the courts as well. We've got our partner assault response teams, and we've got our anger management programs that we can leverage in the event the individual that we're working with requires additional services. But for the point of this presentation, I'm going to focus directly on programs that report to me that are under the reintegration and institutional service model, which I refer to as RIS. So I will get to the housing specifics, but just to paint a clear picture for folks, we've got 3 programs that roll in and provide additional supports to our housing workers. And so the first program, which is the newest, it's called our System Navigators. And this is a new program that's recently under a pilot being funded by Solgen, and they have put us in a really unique situation. We partner with the John Howard Peel, Halton, Dufferin. And the system navigators work specifically with our probation officers. And I'll get into that a little bit on the next slide. Harm reduction trailer team, they are housed directly at the Toronto South Detention Centre, which puts us in a unique position to provide harm reduction supplies to folks that are directly released upon release. We've got our mental health and addictions teams. They work directly with referrals from our probation team. And then we've got our housing services that I'm going to dig into on the next slide. If you can just flip over, please. Okay, so the CRO those are probation officers that work directly with an inmate as they are incarcerated. They work in partnership with the social workers, and our social workers will connect with a client upon as soon as they're intaked into the jail. They create a discharge plan, whether it's working on their GED, working in family reunification. Really depends on what they are, the amount of time that they're spending in jail, and what they plan on working on. And that happens with the social workers. When it's time for them to be released, a few months into that release plan, they will then connect with the CRO. And the correctional resource officer, the CRO, will then work with our system navigator, and we work together to identify what that discharge plan is going to look like. A couple of days before release, the system navigator will go into the institution, in this case, Toronto South, and make an actual basically a warm transfer. Meet that individual, get an idea of what the plan is going to be upon release, and then we work with them in the community. We've got up to about 6 to 8 weeks to get them connected to an internal program that we offer, or an extended partnership that puts them on the track of their discharge plan. The trailer team, they are actually peers, and they work directly with, they're the harm reduction team. So for anyone that's being released, whether it's 8 o'clock in the afternoon or in the evening, or sometime in the afternoon, we open until 10 p.m. And they're there on site for real time. We can provide a phone call to individuals they need to connect with family. We make shelter referrals if they've just been released and they have nowhere to go. We give them tokens, and our primary reason to be there is provide them with harm reduction supplies, and just give them education and knowledge on safe usage, where they can go to get additional supplies, safe injection sites, and they're there to provide them with some accompaniment if need be, and they work with the system navigator if there's a need for them to continue to work in that relationship. So very short, not a case management type of connection, but just real time, just been released, where I go. Our trailer sits right on adjacent to the jail, and folks are there to provide additional assistance. Our institutional workers are also inside the jail, and they work in partnership with the CRO and the social worker to provide Get Started programs, we refer to as drug, alcohol, and addictions programming, ADAPT program that we have in place as well. Our MAPS team, again, those are peer-driven relationships. And these folks work directly with our mental health and addictions clients, and they are referred directly from probation officers. How this helps the housing team, it's twofold. The post-incarceration housing team we refer to as PIP, they are direct private market units. So if an individual is employable and they're currently working, we can provide them with a unit with a variety of landlords that we have in play. If they're on ODSP or OW, it's a little bit more challenging because private market rents are high, as we discussed. But through a variety of subsidies, we're in a position where we can provide them with some help. But these are private market, standardized permanent housing that we provide for individuals that we connect with through the Justice Center. H4G, Homes for Good, is a little bit more unique. And that's really where we can bolster this program a bit, I think, because these are subsidized units. And we have a total of 40 subsidies. Currently, we have about 16 vacancies. So those vacancies will become effective August, and we have a wait list that we have actually reserved for this particular space. So we will have about 8 units that will become live September of this year. So we have, it's not a rooming house setting, but similar. We have folks that are are going to be given an $800 subsidy. The rents are anywhere between $1,200 to $1,400. So with the $800 subsidy that we provide, plus the $400 that they get from their shelter portion, they're getting a unit that is not self-contained. However, it is a unit downtown core, and we provide some supports. Now, it is transitional. We can extend it. We prefer for it to be transitional so that we can continue to get people reintegrate as best as possible, as soon as possible, with as many supports as possible, and then move them along. The challenge with having a permanent unit with a subsidy, we've experienced where now we're not able to help more people. We're only able to help the folks that have that subsidy. And if it's permanent, then we're not in a position to help others. So we would prefer it to be a more transitional model where they get an opportunity to provide supports for up to 2 years. And we would hope that within 2 years, we're able to put them in a better situation, whether that's rent geared to income, permanent through Toronto Community Housing, or other housing providers that can provide more of a permanent, stable unit going forward. And then, of course, we have access to the various banks, whether that be food banks or rent banks. In this case, I've just put the furniture bank because we do have a relationship with them that gets expedited. Within a week, we can help someone furnish their unit if they're housed. And then throughout the case management role, we're providing income supports, training, and educational supports if need be. I think that's it. I'll pass it back over to Holly, or we have any questions for the panel.
Thank you so much, Mark. All right, I see we're right at time. I don't know if we have time for one question. Tasha, what do you think?
I think we can probably do one question if there's something that's come in already.
Well, we did have a couple questions about the trailer at Toronto South. One person asking if it's open again, and another person saying that it would be great to have trailers like that at every detention center.
Well, that's the plan. To answer the latter first, ideally, if we could get the funding, we would have one at Toronto East. We would definitely, at the very least, we've had conversations at the senior management level where we would like to have the trailer mobile. So we have some challenges with the discharge planning because it would be ideal if we knew exactly when folks are going to be discharged. But as you know, there are times when they don't get actually like physically out of the jail until hours after they've actually been, released. So the official release is not scheduled, and times there's some challenges that are more internal to Toronto South, and I'm sure it's indicative across the board for other institutions as well. So that's part of the challenge, and we feel that if we had an opportunity to be mobile, we could then communicate with other jails and sort of just drive around the city and be in places where people can experience the trailer supports a little bit more. So that is something that we're looking at. The trailer is currently open. We are still working with Toronto, the City of Toronto specifically, to get a full, we had shuttered the trailer over the winter because we had some staffing challenges, and I just come in, long story short, we wanted to redesign the availability and the hours of operation. So we shuttered the doors for a little bit, but currently the trailer is open Tuesdays and Wednesdays between 3 p.m. and 9 p.m. Starting last week and going forward until we reopen Monday to Friday.
Great. Yes, we have unfortunately run out of time, but thank you everyone for attending. This was a lot of very great information. These justice centers, this is the third of 4 that we've profiled, and these are just amazing centers. I know these are pilots, but I'm hoping that we'll see a lot more of them over time because they seem like they're absolutely amazing places that will be very effective. And so I want to thank everyone for attending. I want to thank our presenters as well for presenting. And thank you, everyone. Look forward to our next presentation on the 4th Justice Center as well. Thank you, everyone.
Thank you very much.
Thanks, everyone.
Thank you.